Thank you. Thanks, Tom, and thank you, everybody, for this honor to share my experiences and insights with you all. So I was trying to figure out how to start this because really the title is Evaluating Health Equity Means Deep Analysis of Structural Racism plus a commitment to social justice plus strong evaluation skills. And I think for the past year, as someone who's in the evaluation profession, I've really been struggling with this because more and more as we've been asked to evaluate health equity work, more and more I find like I can't just say to people, oh, do you want somebody with quantitative skills, qualitative skills, what kind of evaluation design? Because I realize it's more than that. It's really bringing the ability to help people understand what health inequity is and why that's in health inequity, which means a deeper analysis around the structures that are in place in our nation that keep people from having healthy outcomes. And then the ability to really facilitate these discussions and navigate systems. So I've been on this soapbox about how evaluators are really not trained to do equity work or to evaluate equity work well, because we're trained very traditionally as social scientists to go out, collect data, analyze data, and then report on data. And to do this work well, we've got to be more than that. So I think this request from Tom, an invitation, really made me sit back and think about, well, what is it that I bring to this work and how did I go about it? And some of it's happenstance. I ran into things, I learned things, and some of it was very intentionally going out and seeking a particular type of knowledge and skill. So I'll start by just saying a little bit about my worldview, because I do think that having some basis for the way one looks at the world and understanding that it is inequitable and that it's not about the person, but really the structures and systems in place is really important. Even if it's an incomplete picture, just coming to it, recognizing that I should not assume that it's not a victim mentality, but that it's really bigger than that helps. And so for me, I think growing up, I was in a society in a different country where there was a lot of discrimination and it was all in the institutions. Minorities, racial minorities and religious minorities did not have the same access to education opportunities. And therefore, someone like me actually had to seek an education elsewhere, which is what led me to the United States, because my opportunity in Malaysia was going to be very limited in what I could do. Fortunately, I had the economic means, or at least my parents had the economic means to send me overseas to seek an education. So that was actually an important realization that I had the privilege, but also not because of who I was as a racial minority. And then going to Hampshire College in Massachusetts opened my eyes to a lot of things. Tom knows, Hampshire is full of recalcitrants and that we're always pushing against systems. And opening my eyes there to the lack of support for students of color that were on campus, both immigrant students as well as African-American students. And that this had nothing to do with the faculty member or the administrative staff, because they were all wonderful people, well-meaning people. You wouldn't be at Hampshire otherwise. But it was that there were institutional norms in place that kept people from really looking at it and saying, yeah, why is it that, a group of students of color don't have faculty of color who can support their learning process and who understand them and their barriers and their histories? Why is it that we had to go out of our way to raise money for any kind of campus educational opportunities around, racism and things like that? Like, that wasn't integrated into the system as it is, but we actually had to go out and raise money to do all those things. So I was really part of a movement there where the students took over the campus for I think for more than a week or so, and shut it down in protest of this. And I think those things really opened my eyes to the kinds of institutional racism that were in place that we don't really necessarily think about every day. But as a person of color, you're confronted with it every day. As small as like, going to class and what do we learn in class? What's the history we're taught in class? What's the perspective? And that really shaped my lens for how I viewed the world. And then as I went on, I was exposed to projects that dealt with community development issues and the inequities in communities, especially in communities of color, and trying to strengthen these communities, in part because they didn't have structures that supported their needs to begin with. And in doing so, was exposed to scholars and advocates like Rinku Sen, John Powell, and many, many community leaders that work at the front lines of all of these issues. And so that I was really lucky because I got all of these perspectives and I was able to understand how people thought. I was exposed to research, scholarly thinking, and advocacy. So from there I realized, all right, so there are a lot of inequities in this world caused by norms, policies, and practices in institutions that control resources. And that some of these norms, policies, and practices were intentional, but some of them were they just happened to be in place and inadvertently created those inequities. So in order to break this down, I realized this is bigger than me, which is why I say going beyond the call of duty, because as I realized this is bigger than me, but I have a role to play in it, it helped me put in context everything that I'm doing. That it's not just about a job that we're doing here at Community Science. It's not coming to work at 9 and leaving at 5 and just, meeting requirements and contractual obligations. But it's really about how we can use our work and the set of skills that I have to influence change. It can be small change, it can be big change, but knowing that was just understanding that I have the ability to contribute to social justice and equity. So it's that mindset that I feel like I developed over time through my experiences and come to work every day with. So great, I have that mindset. Now, what is the knowledge I needed? And I think first and foremost was understanding systems. Like, what are systems? Started with Talcott Parsons' work, what makes a system? And how does inequity get produced and maintained through systems? So how do systems operate and function and how they're interrelated? That was the most interesting thing for me to understand, that systems are interrelated. You work on one part of the system, it's going to have a reaction in another part of the system. And it's all connected through these very complex web of, policies, procedures, practices, norms, unwritten and written. And so the task was really to dissect the systems that are in place and find those parts of the systems that's making it hard for communities of color to actually advance and to become healthy. And that was that knowledge that I needed to develop, which meant really understanding the fact that, if you change something in the transportation system, it changes access to transportation for people who then can get to health services, who can then become healthy. Or if you change something in employment, it allows people to have benefits, which then access to health. So all of these parts, getting to see how they're all connected. I think it's also important to note that not everybody thinks this way, right? And so I always find it fascinating that when you get into this kind of work and you take it for granted that people understand systems, it's really hard, because I think what most people are thinking about is just the immediate problem in front of them, right? How do I fix how do I fix those street lights that aren't working? But then trying to understand how those street lights are connected to the way resources are, distributed at a city level or a county level, to how it impacts, safety and the ability to exercise and walk and help, like all of those things, people don't necessarily think that way. And that's one of the biggest challenges we face, because there's no simple way to, well, maybe there is a simple way to explain it, I don't know, but it's not a soundbite, that's for sure.
I actually have a soundbite for you.
Oh, good. What is it?
John Muir, the great environmentalist, says, if you tug on one part of nature, you find it connected to the rest of the world.
Yeah, that's right. That's really true, right? And so understanding systems is important. And then the next step was understanding how do you change systems? And in many ways, this requires people to put pressure on systems, which then is connected to how people civically engage, to be able to influence decisions. And that meant understanding community and how community works and how communities are organized to support their members, so that they can actually have a say in something. And so that actually was really interesting. That was a lot of what I did in my dissertation, was understanding how communities, what the civic engagement looked like in different communities. Because I realized that the way members in a community engage is very much influenced by and shaped by their histories, their cultural traditions, their religion, the current context within which they're operating, which could have been different from the history 20 years ago, but all of that shapes the way people engage and participate. And so understanding community was important, understanding social capital, understanding how two different communities connect with each other to become stronger, and that got into histories of communities, especially, if you're talking about the history of African Americans in a community with the history of the recent Vietnamese immigrants in that community, understanding that and where they're coming from, which impacts how they interact with each other today, is really important. But I think the most important thing is coming into this with the assumption that there's no reason why people would get along just because. I mean, that's like when people say, you put everybody with the same values in a room together, they should just get along. Coming in with the assumption that that is not true is really important. And then therefore figure out how do you actually break that down and help people understand both their differences, but also where they have a lot in common. And Tom knows some of the work that we did in Fitchburg in Massachusetts started with that understanding. So great, I got the worldview, I got the systems understanding, I got the community. Now putting it all together and making it real requires skills. And one of the skills I realized we lack in our training, either as community psychologists or as evaluators, is group facilitation. And I say group processes. I had the privilege of really learning from Don Klein about group processes. And in fact, he was the one that turned me on to the National Training Lab and taking a full week of training there. And that really opened my eyes to what group processes are like. Wow. I'll never forget, it was in, I guess it was in Maine, and there were two great facilitators. They put us in the room and they gave us a problem and they said, go figure this out. And they just stood in the back and watched a bunch of us sit there and try and figure it out. And it was fascinating to see how it starts to unfold, because someone steps into the room and go, all right, well, I'll take charge. And then suddenly someone goes, well, why are you in charge? Who put you in charge? And then the person goes, all right, fine. Then who wants to be in charge? Well, nobody. And it took us about, I think, and the facilitators just sat there and watched all of this happen and did not intervene. It took us 7 hours in that room to figure out how were we going to function as a group. It was very much an eye-opening exercise, because I learned about all the assumptions we have about each other, and like who's the self-appointed leader, and what does that mean? How do you even come to a common understanding about what you're trying to do and who you are? And so we had to stop and really break down and start to actually have processes where we start to get to know each other before we even adopted a certain role, assume a certain role in that group. So with that, I realized, wow, this is a skill to try and facilitate any group. And that was what I started to learn early on, and started going to a lot of trainings, but really watching people was important. I was lucky to be able to be in rooms with really skilled facilitators and watching them. And most recently, I think what I've been learning is how do you call out situations in a room that's uncomfortable. And when you have a room, in fact, full of people who are, there's different racially diverse group of people, and you ask for, you're facilitating a conversation, and only the white people are speaking up in that room. And you're noticing this. And how to actually step back and name that and call it out without making people upset or uncomfortable. That was something I learned recently. And it's interesting to see then what happens. But those kind of skills to me are really critical. And I always say, like, that's what we have to give students who are doing this work. It's a lot of practice, it's a lot of role modeling, it's a lot of watching, and then it's a lot of self-reflection. Really, that's the other part of having the humility, which is a hard skill to teach. Sometimes I think you have it or you don't. But having the humility to step back and say, what do I know? What do I don't know? Being really mindful of that, and being really mindful about how you're being perceived by others, and how you're making assumptions about others, and being able to hit that pause button really quickly on your feet in a room. And that takes practice. And that takes practice in the safe environment. So when you're practicing it, being confident and comfortable that there are others in the room to catch you if you should fall or stumble, or know better, right? And stop you from doing something you shouldn't be doing because it could create more harm. So I think that's the other part to me, the skill that's really important. And it's a continual improvement process. I don't think there's ever a time where any of us can ever feel like we got it. So for me, equity work is about bringing all of this together. And so as an evaluator, we've definitely find that we walk into a space where, yeah, we may have an idea of how we're going to collect the data and what data we need, but actually the conversation starts with, what is your theory of change for that health equity, what you're trying to do? And that conversation is a hard conversation, and it's one that needs to be facilitated. And it's one that you have to bring a systems lens. Because oftentimes people will say, oh, we're going to have, lower rates of diabetes. And you're going, all right, how are you going to get to those lower rates of diabetes? And next thing you know, they're running tons of exercise program. It's not really health equity. You're just providing people more services. And so how do you get people to step out from that space? Because their program is the answer and they know it. And you have to kind of gently help them understand that that's not true, and help them step back and see where the inequity is. And it's not just in the program. And that's really hard. That's one of the hardest things we find, is that often people talk about doing health equity work, but they're just running a bunch of programs. So I'll stop here and see if there are questions or anything else I can elaborate on.
Wow, that was great.
Thank you, Kien. This is Kyra. Can you guys hear me okay? I'm in the car.
Yeah.
Yes.
Yes.
Okay. So I have kind of so my question is more so, thinking about the work that you're doing. I'm really interested in hearing you speak to what you may consider, we all experience what we think are maybe failures or maybe something short of a successful kind of experience where those clients walk out and yes, they understand health equity, and yes, they understand how that work is going to align. But could you speak to maybe situations, if you've had anywhere, that didn't quite happen that way? And I think what I'm trying to get to is, health equity can be such a buzzword, and sometimes, working with certain communities and organizations who have all these different histories, right, that prevent work from actually being able to get done. So I guess in short, my question is, could you speak to instances where you've encountered those sort of complexities? And if you have had situations that maybe you thought were failures, I know failure is such a strong word, but we learned so much from that. Does that make sense?
Yeah. Thank you for that question. I have one, and actually, and I'm going to then define health equity very broadly because I see this as health equity, but it's not in the traditional sense of health. Had a situation where there was in a community where there are a lot of disparities, from economic to health to educational, and two groups came together, two communities came together because there's an opportunity to redirect the state funds, public funds, towards better use of the funds. And the two communities came together, and one person was particularly difficult. And everybody kept saying, it's a personality issue, it's this person. And I felt like, let's not assume that it's a personality person, it's not a person. But I think part of what we're all coming to a room with is important. And so it's really it's two communities, the African-American community and the Vietnamese community down south. And what I wanted them to do and help facilitate a discussion was, well, what's in it for the two communities to participate in this conversation, in this project together? Why is there the assumption that the other would actually cooperate and want to be part of it? And it was interesting because what it surfaced was that one group actually had a little bit more selfish reasons than the other. I think one group felt like if we did it together, we would be stronger. And the other group just felt like, no, we just want to make sure we get what we can get for our community. But it's natural, right? Because the work was going, if the outcome of the work was successful, it meant that the resources were going to be shared between two groups. Two groups that were fighting for a small slice of pie to begin with. And so there was definitely no reason why they would want to do this. And so they walked into the room assuming that they were all on the same page, but in fact they were not. And it was funny because the entry point to this work was actually their logic model, their theory of change. So it was through facilitating that discussion that all of this came up. And I recognized it and I tried to work with them on it. I think it wasn't successful because in the end, the personalities were not willing to step back and look at the big picture and try and figure out how to work through this conflict. I think it was so much embroiled in other kinds of relationships that they had with one another that were really complicated. And so I think in the end, a nonprofit has to say, we're fiscally responsible. Our board wants us to make sure we do the right thing. There's some funny relationship going on here that we can't figure out. And so basically it was much easier to say, we have these expectations by our funder, we got to fulfill them, and therefore we just have to go this route. And this route meant that the one person who was difficult actually decided to step out of that process. So to me, maybe it was successful, but in many ways it wasn't, because they really didn't go through a hard conversation about what it meant to work together. And that's hard. That's hard. I know it is. And I don't know if that's a good way to resolve it. They also didn't have the support from their funder to go through that hard conversation. So that would be one instance where I felt like it didn't go as well as we would have liked it. And maybe the harm is that they would never work together again, or maybe they will, but there's certainly going to be consequences from that work, and I don't know what it looks like now.
Thank
Did that answer
you.
your question, Kara?
Absolutely, it did. Absolutely, thank you.
It reminds me of work we did around the Boston area on the health equity grants. They gave them to a lot of small communities, and they were really looking for innovative work. But in these small communities, if you were talking about something about people of color, you'll know this, you went to Adrian in Fitchburg, and he wasn't going to get anything done. So they had to work around the person who always was the usual suspect, who was there forever and had, and I wonder if the person who was in the way here was similar. And then when they worked around it, all of a sudden doors opened, because there were many more ways of approaching this than the one person had used for decades. And in small communities, with small numbers of people of color moving to the top, you can have a handful of people who just stop everything. And then you have to really sort of say, we're now going to a new generation. And that's never easy.
Yeah. Yep.
Others want to jump in on this?
Hi, this is Nicole. I just wanted to say that I really appreciated the discussion around facilitation and how that humility and being able to hit pause, quickly and in a safe environment is a practice skill. We have a project right now with SAMHSA called System of Care, and it's really around youth mental health. So it's health equity, for behavioral health and mental health. It is very much, I think, a lot of what you have said has really resonated, because it's that tension between, yes, we want to involve families and youth in all of these evaluations, but there's also this laundry list of things that SAMHSA requires that we complete and measure and monitor. And it's finding that balance between, okay, what is the youth and family perspective? What is the cultural and linguistic competent way to approach this work, and also check the boxes that we need to check? And some of those conversations are just really, really difficult. And so I appreciated the idea that it's a constant process of improvement, and that you're never fully there. And so I don't know that I have a question so much as I just really wanted to say that resonated with me.
Yeah, I think that's really true. It's funny because I'm currently in a situation where there's a potential of evaluating some very important voter registration and voter participation work, and the funder wants it to be evaluated. And I'm sitting here going, forget what the funder wants. Let's figure out what's the minimum that the funder needs. And then let's figure out what you all need in order to do better at getting out the vote. I think that so much of it is that the stakes are really high today. We can't be sitting back and thinking about those single incidents, isolated incidents and requirements and norms that have in place, in contrast to really, we are moving backwards as a country and what we need to do differently. That to me, that's really not even something to compare anymore. And it's hard, because it's hard to have conversations with people who have resources who don't see it that way. It is
absolutely.
I feel like we're right in it now as an organization, having to rethink this and figuring out where we can be, more pushy, at the same time recognizing that the people who control the resources continue to want to do it the same old ways. And I think the consolation may be knowing that there is actually people who want to move faster and more radically, and it's finding those people and figuring out how you can support them. I am optimistic that there is that layer of people in government and outside of government, and figuring out how do you support them.
This is also helpful. This is Linda. One of the projects that I'm a part of that's been just so interesting to be a part of is that at University of Maine, the engineering college and the forestry college are working with the Native American nations to try to change the courses so that they combine traditional ecological knowledge from the Native American communities with Western science, and to do that in the courses. And in the grant that they have, they decided to have an external evaluator who would meet the needs set up by the funder. And they asked me if I'd be an internal evaluator to get a sense of what the community really wanted. Once the funding was gone, what does the community really want to have happen in terms of how we go about all of our teaching and our training? It has been just such a wonderful, interesting, difficult, challenging process in terms of, for example, faculty thinking they're in charge and thinking that they're open to taking in and working with and hearing partners that are much more knowledgeable. But that's not necessarily the case. And so all these interesting sort of experiences and discussion and the questions that you're raising and the examples you're raising are just really helpful in terms of thinking about this wonderful, challenging experience. And some of the faculty that are leading the way are leaders in the Native American community. And so they're kind of trying to figure out how to wear both their hats, you know, to bring about these kinds of changes. And Maine is so much about the environment and its history. How do we change what we do? So,
yeah. I recently had a project that I felt was actually very successful, and it's very interesting. It's with a local government, a very large local government, and they wanted to infuse equity into all their policies and practices. So what they did was, there was a woman, a young woman there who really just incredibly smart and also committed. I mean, my gosh, she's so committed to this cause and going above and beyond everything. And she had a boss that was not quite bought into this. But what she did was she realized that to change the government, she needed to build relationships with different leaders in the government. And that's what she was really good at. So she learned how to build those relationships, and she learned how to work around her boss. And to her boss's credit, he didn't support it, but he didn't stop it, right? And we all knew that was what was happening. And I think it was interesting that then what happens is, like, everybody knows it, names it, but no one called him out on it, because we knew that that was just the way it was going to work. So she did that, and then she got the city mayor, the mayor bought into it, his right-hand person bought into it, and then what they did was they got 2-3 department leaders to buy into the concept and got them to actually be the experimenters of this work. And so I actually helped them start with the data. So they said, look, you can't argue with data, so let's start with data. So they got me the data, and it was a very high level data to look at just sort of the demographic characteristics of the staff, the personnel in this department, from the lowest entry level to the top leadership. And that data was really stark in seeing how the racial, ethnic demographics just shift as you get higher and higher up. So basically it became wider and wider and wider as you went up the institution. And so we just looked at the data, and all we did was present the data and then ask questions. And people had a ton of questions. So we collected the questions, and then we went back and dug into the data some more to answer those questions. So we then came back to the group and say, here are the answers to your questions. And then it continued the discussion. And what was great about it was that people started to see the patterns, and they started to raise questions, and this was the systems thing. As they started to say, where in the hiring process do we go wrong? So let's break down that hiring process step by step. And that's what they did. So they got together, and they actually came up with a set of recommendations about what they need to do. There were people in the room that were very frank and said, it's election year, so these are the things we have to stay away from. But these are the low-hanging fruits we can go for right now and let people see that we can be successful. And then how do we push it even more harder and harder as we go along once we get through this election hump. So it was a real lesson, like, geez, talk about sitting right on the like front row watching this, where there's the reality and people accepted the reality. Yes, it's election year. Yes, it's a reality, and we're just gonna have to deal with it. And then there's like, all right, how do we work around this? And the practicality, right? And so for me, it was like, this understanding of like you can't have it all in one day. It doesn't mean that it's wrong. It's not going to be perfect, but how do you find these opportunities? How do you build on it? And how do you keep going at it? I mean, they've been at it for 3 years, you know, and how do you keep pushing? And so there was support given to this individual that was championing the cause. So she got a lot of support from some of us. So there was that one-on-one constantly, like, we're here, you need us, whatever it is. And then there was like people pushing the leadership, you know, a group of people who said, all right, what do you all need? So there was that sort of, yeah, that just friendly support there. We're here. And then there's the work of like breaking down the systems and all of that. But to me, it all goes in hand in hand. You can't leave the champions on their own. I think that's the other real lesson. Is like people who fight this are very courageous. My gosh, I mean, I have the luxury of sitting behind a computer and doing the work, but people who are on the front line, they put a lot out at stake. They put a lot of risk. Her job was at risk, but she felt like there was no other way. It had to be done, and she took that risk. But when she takes that risk, we have to make sure there's enough of us behind her to support. And those are the little details that I think we often don't think about.
Yeah.
You raised an interesting question about the power of group process, and others have said that. I'm wondering, a number of people here are in graduate programs or just recently out of graduate programs. How much exposure do people get to, you know, a Bethel type 1 week group process thing where you're really deep into it? In the surveys, it's always come up very low, but I wonder if that's changing.
The group process system?
Yep. Group process training, you know, what we used to call T groups. You know, you are in a group where you're learning about how groups work and what a role of a leader is. It's all focused on the group process, because all the work of a community psychologist, if they're doing real community work, is all work with groups. And how much skill are we given in that work? Tiffany, you're doing a new program. Is it part of what goes on up there?
Yeah, you know, can you hear me okay?
Yeah.
Yeah, we have a cohort model, and, you know, our students are all professional adults that have often come back to school to advance. And so the cohort model means that they spend a lot of that time together. So I think they learn a lot more about the group process among their own social dynamics over the 3 years that they're together, because they spend every class together. And then we have some projects for different classes, depending on what's going on with the community, that we can find projects where they might be part of a process, but that's not always possible. And then, you know, we encourage them to be doing different projects with different organizations locally. But again, it's just kind of if it's available, if they find it, if they have the time for it. You know, they're all working adults, so it's a challenge for many.
So there's no just straight group process training where that's all they're doing.
Oh, you mean like that we're learning that specifically and reflecting on the process?
Kien was describing a week, was a day or a week where they gave a group a problem, and
right.
It was all focused on what the process.
No, I mean, there's nothing consistent like that. No, if it's possible, we can try to work it out, but no, nothing consistent like that.
Yeah, the National Training Lab, it was a week. It was actually, Monday through Saturday, being on site away. We were in, what is it? Is it?
Bethel.
Yeah, I mean, you were away from everything. You're in Bethel. And I still remember those. I mean, we started in the morning and we would run through these kinds of exercises, stop at 5, have dinner, and then at night would have all these reflection meetings. And there was one exercise where they gave us something that we had to put together as a team. And it was like, I don't know, some building or something. And we had to do it. And when we went through for about 2-3 hours, then we stopped. And what we learned was that in those 2-3 hours, we rapidly went through the whole, you know, norming, storming, all that process. But they never told us what we were doing. Like, that was what we were going to go through, right? So I love the way they taught us, which was we experienced it, and then they gave us the theoretical background. And it was a great way to learn. it's expensive. The NTL stuff is expensive, but and it probably was now than how many years ago when I did that. I just found it so valuable.
But the silence sounds to me like people are not getting that in their programs. Is that fair?
I mean, I'm not technically in a community psych program, but I'm not aware of there being a specific concentration in that.
Yep.
Or a class or anything like that.
Okay, let's not get distracted from that then. Other questions that people have, other things that talking with Kien got tickled.
Well, I have a question for Kien and for others too. So one of the things that I experienced, I'm in a graduate program now, but I'm coming out of about 13 years of working in a national coalition, a nonprofit organization focused on a particular public health topic. And in the more recent few years, we took on a racial equity focus and had some intense funding. And then we were also, in a sense, the vanguards for that field, bringing along the other organizations in our coalition, many of whom had never addressed equity before. So my question is really one of the things that we struggled with, even though we were bringing in trainers and doing all of this group racial equity training, even after all of that, we still really struggled with having a shared definition of what equity meant. And I'm wondering if that's something others have experienced or might continue to experience. We, in the end, to even be having the same conversation at the same time, we ended up working through a three-part definition, more generally, of equity, and then even having to go a step further. And so back to the question about, was there a potential failure? We had a temporary failure where a group was really breaking down because even though they had this general definition of what equity means, they hadn't yet applied it to their specific topic. What does this look like in real life? And what does this mean for me and my job and my corner of the world, right? So we had to then go through a group facilitation process of, let's take our general definition and say, what does that look like in practice in the world for lactation consulting, for example? So I'm just curious if others have had that experience of, potentially struggling with just what does it mean? What does it look like?
Every day.
And how do you address that? What's your strategy?
I don't know. Does anybody else want to go before me?
This is Linda again. I'm on a board for a federally qualified health center that's Maine Migrant Health. And all of the health that we provide is for migrant workers who have come to Maine. Maine is the least diverse state in the country. The migrant workers who are doing such important work come from a lot of different countries. The way we provide the healthcare is partly through mobile vans, but partly through our partners through voucher programs. And a lot of those hospitals really don't typically see very diverse patients. And so we're really struggling. We're spending a lot of time on racial equity issues within the board and within the health center itself to try to figure out this puzzle. And we haven't figured it out, but it's one of the most important things that we're talking about and thinking about and trying to understand and work together. So the question, the issue's so important, and I can't wait to learn from other people who have better answers.
Takes years, it seems like.
I think when you raise the question of racial health equity, what the people in charge here is you're calling us racists. Mm-hmm. You're saying our system is racist. You're saying my staff is racist. And I'm not going there. That's going to be divisive. Mm-hmm. That's not true. And we often, and I know the great discussion Kien and you and I and David had about your work with the National Racial Justice Program, where they were going to set the national stage. This was under Obama, and they weren't going to use the word racism.
Mm-hmm.
And if you don't face up to it, then what are we talking about?
Mm-hmm.
But when you do face up to it, all hell breaks loose very often. And in the health center in Boston that was working on HIV, we brought in some wonderful people who were the experts coming out of the Boston Public Health Commission, who trained that whole coalition. They got very excited about looking at this not just as the homophobia as the issue, but racism as the issue, because we were working with young people. And they adopted it for themselves, and they said, let's write it down. And they said, these are going to be the ways we do it, and we better make sure that our health center agrees with it. And as the program director used to say to me, I got called up to the office again. So everything they did just caused havoc. And the co-director of this program was the only African-American in the administration. And when they had some budget cuts, they cut him. He went on to a much more powerful position in New England, and is a wonderful person. But systems don't want to face up to this.
I think one of the things that Kien, you said earlier that kind of resonated with me, and I think it's related to what we're talking about here, is that kind of the power of the theory of change process, and I think I heard you challenge the question of, okay, well, does this really lead to equity in whatever, right? And so that really kind of stuck with me, because I've found that even through that theory of change process, I'm able to push a little bit, get a little bit more flexibility and comfort in thinking past maybe what we may be stuck at, or kind of thinking a little bit outside the box and challenging those organizations to think beyond that as well. And I don't know, that just kind of stuck with me in terms of how we're defining health equity, and how we're going to do the work, and using that as a process of pushing the envelope a little bit in a safe space.
Yeah, I also think that equity is really multifaceted. I think that's part of our problem, is that we want to simplify it. Mm-hmm. Let's just accept that it's not simple. So, I always say to people, like, what's the outcome of equity? Like, what does it look like? And people often go to disparities. If you close the gap,
yeah,
that means no disparities, you have equity. That's not necessarily true. And I think, and I don't know what the answer is, but I know that I've been saying to people, like, closing the disparities is only one piece of the equity that you're going to see as an outcome, because it also lies in how decisions are made. It's in the process too, and so how do we get people to accept that it's both in the process and also it's in the numbers? Because then this is crazy, because this is what we're up against. Most institutions who have resources, when you say they want to see outcomes, they want to see numbers, right? And I have this going on with people where, like, all right, we want to see the numbers. What's the equity outcome? It's a qualitative narrative. It's a story. And then suddenly that's not good enough, because that's not real. Now, like, we're up. Now suddenly we're battling another front of what is considered science and real data and evidence. Now we're in the space of another battle. Right. And I find, like, that's just what happens. It's really hard that way. And then I think it's also that if you think about equity, I find, like, we need to have, we get into this place where it's crazy, because we get into this space where, white people shouldn't be allowed to talk about equity. They don't understand. Well, we need white allies. Right. So how do we build up white allies while people of color can still be leading the work? It goes hand in hand, but then that doesn't happen. And so I think what happens is that when you have a white person who really who has good intentions, want to try and do it, but then feels like they're being called out as racist, and then that door that just shuts down the whole conversation. So it's that dance of, like, how do we balance all of this out? And I don't know. I just think that. I always say, people come with this strategy, and I always say, like, the David always says, it's the angel's in the details. Actually, how you work out all of these little things in the process that make a difference, because it's where things break down, you know.
Mm-hmm.
In Boston, they do pushback circles.
Really good point.
Pushback circles.
You know this? Which was, people come to the meeting. This is a group of people who continued working together after the grant disappeared, the New England Racial Justice Coalition. And and it was supported the first year, by the way, by an SCRA practice grant that fed the group for a year. They come in, they say, I went to the guy in the agency and I said, here's what it is, and it's going to be about race. And he said, I don't want to hear it. What's next? Go away. And I was devastated. And I said, screw you. So they come to us and they repeat the episode with someone playing their role, someone playing the other person's role, and with two coaches. One who sits there and holds their hand and says, we're going to get through this. And the other one who gives them language. And it's very interesting because it is the micro exchanges like that where we get trapped that you can then rework. And you can feel like you can go to a group of people and rework it in that detail. And I was thrilled by the Jamaica play, Abby Ortiz, who presented this to us, because it's a way of not getting stuck. And this process, I think you're describing it beautifully, is so complex that you can easily get frustrated or stuck.
Yeah.
She has a sheet on pushback circles. I should figure out how to get that around.
I like that. One person holds your hand and the other gives you the language.
and it may not even be you who's in that seat. It could be someone else who chooses to play your role. Right. But it's easy to play that role because we all have been there and we all do the same stupid thing. So it's helpful. Last questions. I'll tell you what this inspires from me is this is a magnificent discussion about health equity. It's just at a higher level than we usually have it. I'd love to figure out a way to do another one of these, not necessarily putting the burden on you, Kien, but if other people can think of ways of maybe a panel of people thinking about doing this 1 month where we can bring this topic back up, because this was very rich. And my experience is we need lots more time on this topic. What are other people's thoughts or ways of doing this?
I agree.
Yeah, I agree. Is anybody on the call also on CIRA? Because I'm on that group and they're looking for webinar topics as well. So I wonder if it might be a joint, it's the Council on Ethnic Racial, am I getting the name right, Jean? Ethnic and Racial Affairs of SCRA.
Who's talking? I can't.
Oh, sorry, that's Megan.
Hi, Megan. Got it.
I know they were talking about scheduling educational webinars for the year, and I was going to look through my list of past speakers and ideas to send them. So it might be a joint project potentially.
Yeah, I'm sort of suggesting that we don't need an expert speaker because there's so much expertise in this room just to have us together again to chew our way through it. If someone's willing to sort of do the kickoff. Well,
in a few minutes, this is Linda. In a few minutes, I'm jumping on a call with people. We're all in the Social Policy Committee for SPICY, for that division of APA. That's the psychological study of social issues. And there's a kind of shared, somewhat different, but also similar discussion going on there. And there may be some opportunity to think about whether we want to have a shared discussion, because it's taken slightly different form, but boy, a lot of similarities.
Well, Megan, maybe you could, again, crossing those boundaries gets more complicated than the internal ones with CIRA, which is an SCRA thing. So maybe we could figure out a way to Kien, you did an amazing job of laying it out in a thoughtful kind of way. And if someone else is willing to do that from their perspective, great. But if you're also just sort of say, let's open up a discussion on what it's like to try to do work on health equity and deal with the resistances in the system that we face, I think that may be all we would need to get a discussion going. Am I being naive?
No. Yeah, and I would be happy to take some of my tools or definitions and organize a conversation like this. I'd be glad to do something if that's of interest.
Great. Well, Megan, why don't we ask you to do that and bring some Sierra people along with it? And we'll do it co-sponsored. That's great.
Yeah.
I hope to get Nuria Chirfalo to do if we can get the dates worked out, a date in January. Nuria is at Pacifica. She has worked with indigenous groups in Mexico for years in the most remote part. And she just wrote a book about that experience with them. And I'm thinking, whoa, because if she says with them, she means with them. It's not like, and I would love to have her describe both the work and how she did it with them. So I'll ask her. But then Megan, you could maybe do the next month. And then if people have ideas, either for topics or speakers who can get the topics going, get them to me. This is a little complicated to set up, but not too much, especially when you get someone as cooperative as Kien has been. So thank you enormously, Kien. That was a brilliant start to the discussion.
Thank you.
Any other final comments from anybody? We have, I think, 11 or 12 people on at different times. Okay. Terrific. Well, thank you all. Thank you, Kien.
Thank you.
And, this was breaking barriers for me in terms of how we can think about using it. So thank you for that. Take care, everybody.
Thank you so much. Thank you. Bye-bye.
Bye, everyone.